This is Jessica Brooks, and I am doing a head to toe assessment. This video is for Excelsior University for Nursing 104, and I have a patient here that is going to be participating, and they have given their consent,
I do give my consent.
and they understand that this is for Excelsior University as well. Okie dokie, so consent is given. So I am going to once again be doing a head to toe assessment. I first would knock on the door. I will come in. I would introduce myself. I'm sanitizing my hands. I would introduce myself to you as the patient. Hello, my name is Nurse Jessica, and I will be doing an assessment on you. Are you consenting to doing the assessment?
Yes.
Okay, can you give me your name and your date of birth?
Darren Ford, June 20th, 1997.
Okay, do you know where you are?
I'm in Detroit, Michigan.
Do you know what today's day is?
It's May 13th.
Okay. Alrighty. So we have gotten the first portion, and she's given us consent to continue on with the assessment. So I do have all my supplies. I have my pen light. I have my thermometer. I have my pulse ox. I have my blood pressure cuff. And I have my stethoscope. All items are clean and sanitized. Okay, so I will now begin the assessment. So first we are going to do the top part, which is the head. So I would wear gloves, and I would look at the scalp. I would look like through the hairs and make sure there's no cuts, bruises, lesions, marks, or anything of that nature that is in her scalp. Scalp looks fine. I would look at the symmetry of the ears, and then I would look in the nose, I would look at the eyes, and I would look inside the mouth and the mucosa. So if you can open your mouth. So mucosa is pink, mouth is pink, lips are pink, no marks, no cuts, no lesions or anything in her mouth, or nothing on the tongue, no redness or anything like that. Gums look good, teeth look good. The lips also look fine. Lips are pink as well. No marks, cuts, or bruises on the face. So now I'm gonna look at the eyes. So I'm gonna cover the right side of her eye, and I'm going to have her look up, down, side to side. I would look at the pupil to see if it is equal and reactant to light, and it is reacting. It is dilating and constricting with the light. Okay, so we're gonna look at the other eye. We're gonna cover the other eye as well. We're gonna go up and down, side to side. We're gonna look into the pupil. Pupil is reacting, equal and reacting to light. So I did say the ears were symmetric. I would be feeling around the trachea, the neck, palpating the neck. Are you able to bend your head forward too? Bend your head backward. Okay. So no issues with the neck. The trachea is not deviated. It is, yep, it's symmetrical. No lumps or anything like that. No, nothing on the skin around the neck or anything as well. So now we're gonna do range of motion with the arms and the fingers. So you can lift your arms up, your arms down. Are you able to, yep, okay. So you're able to move your fingers. Okay, push, pull. Okay, both grasps are equal to both sides. So now I'm gonna look at the capillary refills to each finger. It should be less than 3 seconds to each finger. This hand is less than 3 seconds to each finger. Okay. Less than 3 seconds to each finger as well. So her capillary refills are good with those, with her fingers. You can close your eyes for me, and you just tell me if you feel anything.
Okay.
Where am I?
On my left shoulder. On my left hand. On my right shoulder.
All right. You open your eyes. Okay, so we're gonna do range of motion to your legs. So you're able to bend them forward. All right, you're able to go and touch your toes as well. Okay, you can have a seat. All right, so are you able to bend legs up and move your foot?
Mm-hmm.
So, yep, side to side. Okay, good. So I would look at the toes, and then I would do the same thing as with the fingers. Just make sure all the capillary refills are good to each foot, which they are. No abnormalities, and I would do the pedal pulses on each foot and the anterior tibial. Okay. Pedal post right here, and then the anterior tibial is just behind the ankle bone there. And the pulses are all palpable and felt, strong and bounding. Okay. Alrighty, so now we are going to take this shirt is actually supposed to be, she's supposed to actually have a sports bra on, but for her comfort, we just got, if you can turn around and see, this is very thin, so we're able to get pretty much close to the skin with this. Just for informational purposes. Okay, so now we're gonna take a listen to the lungs and continue with the vitals. So I would take her blood pressure. Normal readings are typically between, well, I know the normal reading would be like 130 over maybe 60. So anything over that would be pre, and anything beyond 35 over 70 is they start saying hypertension. But I would just check her blood pressure and make sure the blood pressure is normal, within normal limits. I would take the temperature. Temperature is 98.0, that's normal. I would look at O2 and pulse. So O2 is 98 room air, and her pulse is going to be 76. I am going to listen to her lungs, and then I am going to do her apical pulse. Also, we'll be doing respirations as well. So if we can face the camera here.
Mm-hmm.
So if we were doing the apical pulse, we would go above the midclavicular line, and then we would count down 1, 2, 3, 4, 5 to the 5th intercostal space. We would listen to the apical pulse for 1 full minute. So clavicle, 1, 2, 3, 4, 5, and the apical space. And according to the second hand watch, we would do this for a full minute. We would be listening for any abnormalities to make sure there's no skips, or we would just be listening to any just any sounds coming in and out while we're listening to the heart. The love and the dove. Okay. So the apical pulse I got is 91. So now we're gonna take a listen to the lungs front to back. So deep breath, in and out, in and out, in and out, in and out. Okay. So I hear no wheezing, no stridor. Lungs are clear to all fields in the front. I hear nothing abnormal. So we're gonna turn her around and listen from the back. Deep breath in and out. Deep breath in and out. In and out. Deep breath in and out. Breathe normally. Lungs all clear to clear to auscultation. I'm sorry. No wheezing, no stridor, no crackles. All are within normal limits. And turn around. Okay. So no observation as far as anything to the skin. She has no cuts, no bruises, no marks, or anything like that to the skin, with the exception of maybe 2 tattoos here. But no cuts, no lesions, nothing like that. Okay, so we would typically lay on the back and we would do all 4 quads of the abdomen for 1 full minute, or until we at least hear activity to each quad. So I would be laying her down on her back. I will first auscultate and then I will palpate. So I right now will be auscultating all 4 quads until I'm gonna do each quad, and it would have to be 1 full minute if I don't hear it right away. And this is per quad. So we're on the upper right. I'm gonna listen for 1 full minute or until I hear something. So I hear activity to the upper right quadrant. So now I don't have to do the full minute. I can just go on over to the next quad and listen until I hear. Okay. So I'm gonna go to the right lower quadrant now. Okay. Then to the left lower quadrant. Okay, heard that. Okay, now that I am done listening to all 4 quadrants with the patient laying flat on her back, I would begin to palpate. So what I would do is I would be palpating now I would be doing upper right all the way over to the left. I would be palpating for any lumps, any pain. I would just go all the way around. I would press above the umbilicus under. I don't feel any lumps. I don't feel any distension to the abdomen. We will be checking for distension and firmness. None of that. Pain in any of these areas?
No, no pain.
Okay, we will be asking about pain. There's no pain there. So abdomen has activities to all quads, no distension, no firmness. All are soft and tender. Patient states that there is no pain. Patient was also able to move all extremities. Patient was able to, her pupils reacted to all the light. She was able to recall her place, situation. She was able to tell me her name, date of birth, everything like that. Okay, so we're gonna turn around. So now we have concluded this assessment. I would wash my hands and I would re-sanitize my equipment since I've used it. And as I'm doing, I don't have to do this now, I can do this afterwards, but I'm just verbalizing that that's what I would do after the fact. So now we are at the patient teaching portion. So do you have any questions for me before we conclude this assessment?
Actually, I was supposed to be getting some wisdom teeth pulling done this weekend on my right side, both of
Okay.
them actually. And I was wondering what the aftercare would be like as far as like so I don't get an infection or anything.
So you want to know basically how to prevent infection once it's complete.
Mm-hmm.
Okay. Well, the first thing would be to look for signs and symptoms of infection. So say you've already had your teeth pulled and you notice that, the pain is going to be normal and swelling is also going to be normal.
Mm-hmm.
So do expect those things, but you would be looking to make sure that there's no pus, there's no foul odor. You would be looking at the color to make sure that there's no green, maybe even like greenish, yellowish, or especially bright green.
Okay.
So look for that. Pay attention to if there's any odor or anything like that. Whatever pain management that they give you, they'll probably tell you to alternate between Motrin and Tylenol. I can't really say what they'll give you, but just take your pain medication as prescribed, and then you just know to look for, like I said, and then if the pain is just persistent no matter what, even if they've given you something, you want to look in about that.
Okay.
Pay attention to your temperature as well. Make sure your temperature does not go over 100.1. Because anything over that, you would be looking at, maybe infection, because temperature is also an indication of an infection trying to occur.
Okay.
Pay attention to swelling around the face and around the neck, and just make sure that you pay attention to their discharge instructions based on what happens after the procedure.
Okay.
So I don't know the full extent, but definitely pay attention to that, and make sure you also ask the doctor as well.
Okay. So for the general part, look for discoloration, foul odors, watch out for my swelling, watch out for my temperature as well, because that's an early sign. And if the pain is proceeding even after I take medications, that's when I should come in to be seen. Okay, I understand.
Alrighty. So this will conclude the assessment, and thank you for watching.